Most of our point-of-care tools are very deterministic. They're written by experts, they're peer-reviewed, they're authored, and this is a brave new world for us. So the things that I tell people to look for are first, who is giving you this information? Where is it coming from? What is the authority behind it? That's what we do with anything in medicine, and there's nothing different there. The second is really to look at the words critically in the same way that we look at anything critically in medicine, like a new clinical trial or a new drug. You think actively about the words that were said, and then make sure that you can trace those words all the way to their origin. So that concept of traceability, these words are now generated words by a machine. Can I trace them back all the way to where they came from? So that's probably number one in terms of concrete things, is the traceability. The second is the methodology, understanding how any sort of AI tool or system works. When we bring something new into medicine, we really understand how it works. Understanding the methods by which an AI system or tool was made is equally critical. That transparency is important. And the third is probably that it's purpose-built. We're in an era where there is a whole bunch of new, very generic tools that are trained on wide swaths of information like the internet. And they use knowledge from the internet, model knowledge, to give very authoritative sounding answers to clinical questions. But those are sort of the guise of authority, not truly authority. So understanding where that information came from and whether the tool that you're using is built for purpose and what content it is drawing upon to make its decisions is critical. And then the detail in that is probably a technical detail. It's something we can measure, right? How often model knowledge or generic knowledge is used to generate that answer should be absolutely part of your decision making when you're deciding to use a tool or not, because you want to know that the information on which that model has generated something is right for your purpose. And the last one I'm going to say, number 4 in here, is really, I think, the one that's most difficult to explain but the most important is models are wonderful at extrapolation, of taking an article from the medical literature and doing some leaps in logic to give you a very seemingly good sounding answer. But it isn't good, right? Because that original article wasn't for that purpose. It might not be about that thing, and it might be the closest thing that's out there, but it is not the answer to your question. So when you look at a tool, be very detailed when you look at how many leaps in logic a system has made to give you the answer that sounds very palatable, but make sure that it is.